Okay, good morning to all our viewers. Um, Today we have with us Dr. Payal Patel. Very interesting topic we have for today, talking about oral hygiene. Um, as you can see, Dr. Payal has a very wonderful presentation for us, and we'll give this opportunity to her to just briefly introduce herself. Over to you, Dr. Payal.
Thank you. A very good morning to you all. My name is Dr. Payal. I'm a practicing resident dentist at Aga Khan Dental and Implant Center, Nyali branch. We have three branches. One is Kizingo branch, other branch is Nyali, and another branch is Kilisi branch. So today's topic is oral hygiene. Basically, I want to talk about dental hygiene related to your medical health. I would like to start the presentation by Dr. Jeff's quote, as it is time for us to think of our mouths are somehow not connected from our rest of the bodies. The same blood flows through them, the same nerves goes to them. So in short, to have a healthy body, one should have a healthy mouth. We don't think that dental health is linked with the medical health. I would like to tell you a story of my client, Debbie. Debbie had pus on her thigh, and that pus, she had first initially a pimple that ruptured into abscess. And then she went to a doctor, a general doctor. The doctor put her on antibiotic and the pus went away. Second time, again, after a few weeks, Debbie got same abscess on her thighs. The doctor put her antibiotics again, and again the pus went away. When it came for the third time, the doctor decided to do a culture. Surprisingly, what is causing it? They were surprised to see the lab reports. The lab reports said the bacteria which was present is an oral bacteria. Debbie never had any pain. Debbie didn't have any toothache. How could be a dental bacteria? So the general physician asked Debbie to see a dentist. On examination, when we saw Debbie, we found 3 abscessed teeth, which absolutely had no pain and nothing hurted her. So Debbie's dental health had definitely a lot more to do than her medical health. Let's have another example. One of my friends who was 34-year-old had an open heart surgery. After his surgery, the surgeon told my friend the actual reason behind the heart issues was his oral bacteria. He was surprised, and from now onwards, he's taking a good care of his oral health. You will be surprised, in US, more than 600,000 deaths per year is due to heart attack. And the researchers found out of these 600,000, 50% is related to the dental infections. Yes, more than over 300,000 deaths are due to heart attacks caused by the preventable dental infections. So it's a big thing. When you say the heart attack, it's a big statement, is related. The oral bacteria, they go into the bloodstreams, and that is how it is spread throughout the heart, and it causes a cardiovascular disease. It's a very big statement that the heart is linked to the dental bacteria, but it is very much evident. The researchers have found out. People are surprised that nothing hurts, there's no toothache. Why they should go to a dentist? But similarly, in the same way, they can accept the fact that diabetes, glaucoma, blood pressure, they also don't hurt, and still people have it. It's similar same way, the gum infection, 90% of dental infections don't hurt at all. The researchers have found out in Alzheimer's disease, there were oral bacteria in patients' brain. Inflammatory diseases, there is an oral bacteria which causes it. In pregnancies also, it is related from pre-births to stillbirths. So oral bacteria plays very important role. So one should take a very good care of their oral hygiene. because they may cause, other than the oral dental diseases, they can cause a systemic heart disease. If something doesn't hurt, doesn't mean that you're okay. I'm a dentist, that's why I like pain. As long as we don't like to cause the pain, but we like to treat pain. Pain is a good motivator, a good motivator. How many of you have been to a dentist without having a dental pain? I'm sure most of you haven't seen a dentist until you have a toothache. So I consider pain as a great motivator. Pain indicates that something is wrong, but one should also go on a regular visits to a dentist. Now let's quickly brief up about other dental histories. Other than systemic, what does oral hygiene do to your oral mouth? Because that's the most open, susceptible cavity where the bacteria goes in and gets absorbed in your bloodstream. What is oral hygiene? Oral hygiene is the process of keeping your mouth, teeth, tongue, and the oral tissues clean. A good oral hygiene can prevent systemic disease, dental cavities, gum infections, and other dental related disease. We would see eventually what other dental diseases are caused lack of oral hygiene can do, and what is the importance of good oral hygiene. Good oral hygiene is important for your well-being. It helps you to eliminate the cost of the treatment, the toothache, and the vitality of the tooth is preserved. And in most of the developed countries, also, you would see it is the oral hygiene plays a very important role. Now, I would like to see by not maintaining your oral hygiene, what can you prevent? You can prevent lot of diseases. First, related to oral health, dental caries, dry mouth, gum disease, which includes periodontitis, gingivitis, and bad breath, which is called halitosis, and oral cancer. We will briefly see what are these diseases. What is dental caries? Dental caries is also called, you would layman in a layman term, you would see a tiny black hole in your mouth, and it is damaged permanently. It is caused by the bacteria. Dental diseases are caused by variant. It is lack of saliva in your mouth can also do, because saliva helps to lubricate your mouth. It flushes out all the debris and food particles which are remaining. If there is lack of saliva, the bacteria multiplies and grows and causes tooth decay. Secondly, it could be your diet. If you're having food which is very rich in carbohydrates, sticky food which tend to stay in between your tooth grooves, the bacteria grows, attacks on them, creates acid, and that is how the hole is formed. Lack of hygiene is also one of the reasons of dental caries. Not brushing regularly, properly, using inappropriate toothbrushes can cause dental caries. What is the treatment? At an early stage, if you go for a regular checkups to a dentist, the dentist would suggest you fluoride applications. If it is treated, maybe a filling or a crown. On inverse scenario, you might need a root canal followed by a crown. What is dry mouth? I want to talk about a little bit about dry mouth. Dry mouth gives halitosis. Dry mouth can cause you more tooth ulcers. There's lack of salivary flow inside the mouth. It can be either medications which certain medications can reduce the salivary flow. If you have dentures and you have dry mouth, you'll be having sore mouth, and the dentures will be intolerated to the dentures. So dry mouth is, one should treat the dry mouth. Either you have lot of it is also called a xerotomia, and you can either take lot of, the doctor would suggest you medications regarding to your conditions. You would have cracked lips, sore throat, change in the voice. These are all caused by the dry mouth. Secondly, gum disease. It's a big topic, gum disease itself. What is gum disease? Gum disease includes gingivitis as well as periodontitis. Anything bleeding from your gums or any inflammation of your gums is called as gum disease. In gum disease, there are bacteria they go in your bloodstream. They, they, these bacteria produce a lot of toxins and any kind of infection which eventually turns out into pus. So any inflammation in your gums is called as gingivitis, which is reversible. If you don't treat, it goes into the second stage, which is called as periodontitis. Periodontitis would attack your bone and your jawbone, and it would make your tooth loose. And eventually you might have a tooth loss and a severe periodontal condition and a pus. Now what is this pus? Pus is like a white sticky substance. It is made of dead tissues, debris, toxins, inflammatory proteins, and harmful bacteria. These bacteria get absorbed in your bloodstream. And where does this pus drain? If you see inside, you cannot see it. If it is outside of your body, you can just structure it like a pimple and drain out the pus. But if you can't see, it goes into your bloodstream and it gets absorbed by your heart. From the heart, it goes to the lung, back to the heart, and then it comes out to the remaining parts of your body. So these bacteria are going into remaining parts of your body, causing a severe cardiovascular disease. This cardiovascular disease, if you would see, it causes stroke and heart failure, which in turn leads to inability. So you would see a small bacteria causing a big damage to your oral health. So I would emphasize the gum plays a very important role to keep your mouth clean, because this is where the bacteria grows and multiplies and causes a severe gum infection. So any kind of infection, you would be surprised, there's a direct relation of gum disease with your dental health and diabetes. They have a bidirectional relationship. If you have a bad gum disease, you will have a bad diabetes. The diabetes will be under not control. If your gum disease are good, the diabetes is under control. So they are very interlinked. Similarly, would anybody think about having an infection would cause a high blood pressure? Yes, a dental infection can cause a high blood pressure. Any kind of infection elevates your blood pressure. So we had a nurse who always complained of a high blood pressure, and she was constantly going to the physician on a regular basis. She was being prescribed medications for the blood pressure. One day we thought of having a thorough oral examination, and we found out she had a dental infection. She had a bad abscess lower molar, which we extracted eventually, and her blood pressure after that was under control. So many physicians are not aware that dental health should be a part of a physical complete body examination. Unless we won't know, a physician or a doctor should not only think about treating only the symptoms, but the source of infection, which could be a dental infection, which nobody thought a general body package should include a dental examination as well. So in terms of being infections and everything, the gum oral health hygiene plays a very vital role. The gum diseases could be treated if it is at an initial stage. A regular dental cleanup once every 6 to 8 months can rectify gum disease. On a severe cases, you might need gum surgeries, bone grafts. So these are the variant. One should see their own dentist to sort out the gum disease. Another kind could be an oral cancer. Any cancer, oral cancer, people would not know at an initial stage. It could be diagnosed at a very early stage. It could be a constant irritation from your mouth, constant third molars which don't have space, and constant cheek biting could cause gum oral cancer. Chewing of tobacco or HPV virus could cause, if a person has a habit of having tobacco or smoking, could cause oral cancer. So early diagnosis plays a very important role. Or a non-healing ulcer, one should not ignore if the ulcer is not healing and it's been there for a long time. So it could vary from an oral surgery to a chemotherapy to a radiation therapy, depending on your condition. The doctor would do biopsy and would let you know about oral cancer. Now, what are the basic steps in maintaining your oral hygiene? One could start at home by proper brushing, by good mouthwash, frequent rinsing, flossing your teeth, proper diet, and regular dental checkups. We would go through them briefly about what could brushing do, how one should need a proper toothbrush to do it. So toothbrushes play a very important role. ADA have certain specifications of toothbrush. They come in various sizes, shapes, bristles, so it plays very important role. One should change the toothbrush every 3 months. Soft toothbrush is always recommended than hard brush because the harder the brush, it causes tooth wear. So soft single tufts toothbrushes are also available. These toothbrushes are made of nylon and they help in effectively cleaning between your teeth and underneath your gums. They help to because one need to clean the gingival pocket. So soft brush is recommended. Otherwise, if you use hard brushes, they may cause tooth sensitivity, because of gingival recession and abrasions. So, what kind of brushes? Everybody should brush 2 times a day. Ideally, if they can brush in between their frequent meals, is the best time. But minimum of 2 times of brushing for at least for 2 minutes is recommended. What kind of toothpaste one should use? One should use a fluoridated toothpaste because it helps you to fight against cavities and brush not only your gums but as well as your tongue because the bacteria could again stick around on your tongue as well. Always use 45-degree angulation. In the next slide, we would see how to brush properly to clean your gingiva as well as your teeth and the amount of toothpaste what you use is. For children under 2 years of age, you should use a grain-sized toothpaste. Between 2 to 5, you could use a pea-sized toothpaste. And the adult portion, you can have a regular, children above 5 years. Fluoridated toothpaste is generally recommended and the way you brush is very important. So the next slide shows proper brushing method. Always engage, in the first image if you see, always engage the brush at a 45-degree angulation. I would prefer to brush the far end tooth first with the toothbrushes, the bristles, targeting 2 to 3 teeth at a time, and one can use circular or a back and forth pattern of brushing. Then you move, in the second picture you would see you move a 2-3 teeth front ahead. Similar, it would be a rotating back and forth strokes. Once you brush the outside part of your teeth, the third image shows you should brush the inside bit, keeping again at the 45-degree angulation between your tooth and the gums using back and forth and rotating movements. Coming to the front part, the inside bit, keep the brush vertically, brushing from gums towards the teeth in a soft stroke from the tip of the toothbrush. And lastly, one should brush the biting areas in a small rotating circular pattern because our teeth are not flat. They are like valleys and curves. And in these grooves, if you don't keep it clean, the bacteria will stay, the food particles will stay, and it will lead you other dental problems. Apart from brushing, one should also floss because brush would clean the surfaces onto your teeth. But to clean in between, one should use a dental floss. It helps you to get the food particles and debris which are stuck in between the teeth. These dental floss may be nylon, they can be a plastic monofilaments, can be waxed, unwaxed. You could either use a super floss or even mint flavored flosses are available. Generally, there are different kinds of flosses. One kind of flossing is a spool method where you get in supermarket like a Oral-B or Wisdom packet where you can just remove according to your choice, like you can cut through 18 inches. You have to roll it between your fingers, snap slowly, pass it slowly between your teeth, use back and forth, and remove the food particles. So every time when you introduce to a new place in your mouth, the interdental space, use a new portion of floss, new areas of the floss. We'll quickly see how to use spool method. In spool method, you do 18 inches of floss, rotate in between your fingers, take the help of your index finger and the thumb to pass the floss in between your teeth in a C-shaped, slowly pass in between your underneath the gums to clean out the food debris and use back and forth motion. Lastly, but not least, floss the backside of your molar as well because there the food particles and the debris would stay. Second method of flossing is a loop method. You get a pre disposable tips of flossing where you can use it, pass it in between your teeth, and it will help to clean. Or you would have a floss holder. You take a desired amount, fix the floss into that, and you put knots, and you can clean the teeth back and forth. It could be disposable. These kind of floss is very good for people who have lack of dexterity, people who can't have arthritis, who can't hold toothbrushes for long, or flossing normal school method of flossing. They can use the loop method of flossing. So that is what about flossing is. Another reason for good oral hygiene is your proper diet. Studies have shown the carbonated drinks are more acidic than the non-carbonated drinks. The good hygiene, the more healthy snacks you indulge in, it is better because food which are rich in carbohydrates, they again cause tooth decay. They are starchy, the bacteria would stick on for them longer, produces acid, and then you have tooth decay. As well as they tend to, people who take a lot of fruit juices, again, the fresh fruit juices are also more acidic. So you should always dilute your fruit juice to get less acidic because these acids will break down your tooth enamel and then they'll cause tooth wear and tooth decay. So limiting the amount of sugar is very, very important. One should indulge into healthy snacks. I would say good amount of cheese, vegetables instead of having crisps or the packaged juices. So the diet plays a very important role. And I would like to say there are other means to clean interdental tooth as well. You would get wooden wedges, single tuck brushes. These tuck brushes, when people have periodontal disease or anything, they can take medicated gels and deliver to the gum pockets. Or if you have a bridge to clean, you can use interdental brushes where they come in different sizes depending upon it is narrow or wide, which is available in the supermarket. You have wooden or the plastic wedges as well to clean in between your teeth. I like people who undergo orthodontic young kids. It's very difficult for them to clean in between the teeth. Now you have super floss, which helps you to clean in between the teeth where you have braces, where you find struggle to remove food particles and debris. And they are also very good for the patients who has multiple bridges or crowns to clean underneath your bridge. These super floss goes very easy and they're freely available to clean underneath your gums as well. Last but not least, I like rinsing. Frequent rinsing also can help you because the amount of food particles you flush out every time you rinse, so it helps you to keep your mouth germ free. These mouthwash could be regular rinses, could be a fluoridated mouthwashes, uh, chlorhexidine based mouthwash. Generally, the mouthwash one should prefer is alcohol free because alcohol will again dehydrate your oral cavity and it will dry out your mouth. So I would recommend a fluoride-based mouthwash is very good. But on a regular basis, one should not use the chlorhexidine-based mouthwash because it might cause staining of your teeth on a long-term basis. So follow the instructions of your dentist if you're doing or a manufacturer if you're using a mouthwash. But if you are doing a frequent rinsing after every meal, you're doing a great job. It would limit the amount of infections or the bacteria, allowing them to grow in your mouth. Another thing is available nowadays in most of the developed countries is a water flosser. Water flosser is a very good way you can clean your mouth. How does it work? It has a pulsating and a pressure based movement. They work hand to hand, they create pressure, and it flushes out the water and the food debris which is stuck in between your teeth or under your gingival margins. It is very good for the children who are undergoing orthodontic treatment and elderly people who has arthritis or who has Parkinsonism, they have difficulty in holding the brush. They just flushes out and it's a very good mode of cleaning. I would like to show you how does the water flosser looks like in the next slide. You could see it has a pressure build up machine. One can put mouthwash to have an antibacterial control, and under the patients it flushes out very forcefully. So it's a great thing. If you have not bought, please go and buy water flosser. It's very good. It's like a portable thing, and they have different tips. So one machine, a different time family members can use it, having their own tips. So it's a good value for money and to keep your bacterial growth, which in turn leads to systemic health issues. I would like to talk about tongue scrapers. These tongue scrapers are the devices to eliminate the bacteria from your tongue or from growing. These tongue scrapers, because in your tongue it could be, what is it? The bacteria builds up debris, it could have fungus, dead cells. So by scraping out, you are eliminating from the surface of your tongue. These tongue scrapers could be either inbuilt in your brushes, which you see the serrations behind your toothbrush, or you get a special tongue scrapers which are made up of plastic. And by cleaning this, you prevent halitosis, bad breath, because these bacteria gives a very pungent smell in one's mouth. Lastly, I would like to say regular visits for your dentist is very important. You and your dentist can work hand in hand to give a very good oral hygiene. A regular checkup every 6 months is mandatory, irrespective if you don't have any pain. The dentist would just have a good thorough dental examination if you have any dental infections or anything. He or she would suggest you, and I would recommend a good cleanup every 6 to 8 months is very, very important. Even if you're brushing very nicely, one must go to a dentist for a thorough cleanup. By this, you're eliminating bacteria, and in turn, it's saving you money from oral diseases as well as any systemic health related issues. Lastly, I would like to say good signs of oral hygiene is the teeth, the gums are pink, they don't bleed, the mouth smells wonderful, and bad breath won't be a constant issue. So, in short, one should look after themselves not only if you don't have any pain, nothing, but you might never know. Any systemic disease is related to dental health. So I would emphasize, if you've not gone to a dentist, please book your appointments and go and visit them. Thank you.
All right. That's a wonderful presentation, Dr. Payal. To our audience, let's give her a few minutes of so that she can relax. We'll just take a 3-minute break. In the meantime, we'll play one of our dental videos, and then we'll get back to the question and answer session after that. I'll see you in 2 minutes.
Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji, and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception at least 1.5 meters apart, so that to minimize any potential infections. We are also screening our patients coming. However, I'd like to say that the services remain unhindered and that we are running as usual. You are always welcome to visit us in any of our 8 outreaches within the coastal region.
At this point, let me also remind you all, we have put in place teleconsultation services to ensure that our patients are able to access our services safely from the comfort of their homes.
To our audience, this is now the question and answer session. It's an opportunity for you to ask as many questions as possible about oral hygiene. And Doc, maybe we'll start by this first question where someone has asked, what are the signs that I am in dental trouble?
What are the signs for dental trouble?
Yes.
So generally, as I said, few dental infections, there are no signs, there's no pain. One might, in this worst scenario, one might have a toothache, might have bleeding gums, might have a pus or a swelling on the mouth. Sometimes you don't have anything, you feel pain in your ear and neck. So these are all the signs. But generally, most of the times, people at the initial stage, they are asymptomatic. They don't even know that they are, what is coming to them. Yeah.
Okay, thank you, Doc. Can mouthwash protect the cavity?
Fluoridated mouthwash can protect the oral cavity, but you can't just rely on mouthwash. It works in hand your brushing way. It does have an antibacterial activity. So depending on type of mouthwash you use, but it can't work alone. Your brushing, your dedications towards the mouth is also responsible.
Oh, fantastic, fantastic. Someone has made a very interesting comment. Doc, you talked about the water floss and the tongue scraper. Please advise us where they're available in Mombasa and what could be the price.
See, water flosser, I know at one of the pharmacy at the Links Road, at Links Pharmacy, they keep water flosser. They range from 8,000 to 10,000 Kenyan shillings. And tongue scrapers, it's very hard to find, but as I told in my session that few toothbrushes, you will see at the back of the toothbrush, there are serrations behind the toothbrush. They can act as a tongue scraper. These serrations are designed to clean your tongue. So if you would see few Oral-B or Colgate, you would see behind the head of the toothbrush, they have serrations. They help you in cleaning the tongue.
Okay. Someone has asked, I'm based in Nairobi, the weather is quite chilly. Every morning I wake up with pain in my teeth. Can the cold weather affect the teeth?
It cannot affect the teeth unless if you have a tooth wear or any recession near your gums. The way you brush, if you are brushing in a wrong way, like horizontal brushing instead of doing circular way of brushing, you might erode the enamel near your gum line. And when the temperature decreases, when it is too cold, that is when, because you've already lost enamel, and the second layer of the tooth is very sensitive because it has dentinal tubules. So once it is exposed, you feel cold. It is not like the cold weather is getting you sensitivity. That means you should go and see your dentist. Either you have lost a layer of your tooth or you have a dental cavity.
Okay. Thank you, Doc. I hope that question has been well answered. Someone has asked, do you do dental X-rays in your centers?
Yes, we have digital X-rays, which gives a very minimal amount of radiation exposure. We have full mouth X-ray facility. We have CBCT scans. So we have a wide variety of X-rays available at our facility.
Okay.
And very modern technique which uses very minimum radiation to take X-rays.
Okay. So someone has asked, do you offer dental services such as removal of plaque, discoloration from teeth, and how much does it cost?
It varies. Everything, it depends. Right now we are running 20% discount on our all dental treatment. So yes, we treat discolorations, cleaning of dental plaque, depending on person's type of discoloration we treat, because some you might think it's a brown stain, but people are born with that brown stain, which is called as fluorosis, which is intrinsic stain caused by the fluoride intake in your water, and it needs a special treatment. So plaque removal is a basic thing one could start with, depending on, one should come and see us to know the exact pricing and what one needs. Well, right now I would say we are running 20% discount on all our dental treatment. So you're most welcome to come and get yourself treated and examined.
I guess the next question is also price related. So someone has asked Farida, how much is tooth extraction, caps, implants? Please reply so that I can budget. Thanks.
I would say dental crowns, dental implants, even on those we have discount. It starts from, you asked about dental implants. Dental implants, now we have to see how good is your bone. But basic, it starts from 120,000. Yeah. And about crowns, we are running discounts. It starts from 23,000. Yes.
Okay. How much is a dental checkup?
It's 700 shillings at the moment because we are running discount on our dental procedures.
Okay. And do I get to see, do I get to have a hygienist appointment to clean the teeth?
In Mombasa, unfortunately, we don't have hygienists, but our dentists are doing the dental hygiene thing. Teeth cleaning, polishing is done by dentists at our facility. So if you want to just book through our numbers, and the receptionist would book for you the dentist for your dental cleanup.
Okay. Someone has asked a very interesting question. Very nice presentation, Dr. Payal. Please assist with more details about your treatments and your equipment. What do you have that would make your center better?
We have the latest technology in our centers, maybe for teeth cleaning, like we have a traditional cleaning followed by an air polish, which not many facilities have it. So we have the latest technology about taking x-rays, diagnosis, and we have a dental team with us working together to facilitate. We have an implantologist, we have an orthodontist. So we have a team who can give you a better, complete oral health. So our machines are very latest. For the root canals, we have the rotary system. We don't use anymore the manual system of doing root canals. Gum surgeries, we have the latest instruments. For implants, we have the latest machines. So yes, and we work as a team. We have a whole facility so that you can do braces, tooth implants, gum surgeries, bone grafts, and advanced dentistry, dental jewelry. Yeah.
Okay. What can one do if I do not want to floss?
You can use air water flosser if you don't want to floss. It also flushes out in between the teeth. And if you don't want it, you have interdental brushes to use to brush in between your teeth.
Okay. Are sweets really bad for my teeth?
Yes, sweets are because they are high in sugar.
Okay.
Well, if you want to eat, obviously we are human beings, we need to enjoy.
All right.
You should limit the amount. I would say if one would like to eat, I would recommend to have before lunch because once you have the sweet before lunch, say about if you're having salad in your lunch, the salad will act as a cleansing thing to flush out the sweet substances from your mouth. So I would say one would not totally avoid sugary things, but the time you eat is very important. Don't just eat sweets and go straight to the bed because the sugar is high in your mouth, the bacteria will grow and multiply and then they'll do their job. So I would say if you want to give your kids sweets, I would say choose the wise kind of sweet, like normal sugar in the fruit, or you want to have stop giving them caramelized based chocolates because caramelized chocolates are very sticky. They tend to stick on your grooves and then they will rot your child's tooth or your teeth. So you have to be smart enough to play around. Give them before the lunch so that once they're eating the lunch, the food what they're eating will help to flush out the sweet things.
In fact, now on the topic of sweets, when you go to some Asian restaurants, there's normally some kind of sweets. So it's sort of a mint or a seed that they
It's
give
after food, yeah.
after food.
Yeah, yeah.
How does that help?
It doesn't help. It's like it is like people in back old days in ancient, they act
Yes.
as kind of refreshment
Okay.
once you're eaten.
All right.
But then again, if it stays in your mouth for long because they are sweet enough, it will rot.
Okay.
So I would say if you're doing it, please brush your teeth in the night before you go to bed.
So it has no
No beneficial. Yeah.
Okay, so we have a couple of more questions. Can teeth sensitivity be treated?
Yes, of course, it could be treated.
Okay.
Depending what kind of like teeth sensitivity again is caused by tooth wear, either through your brushing, people who have acidity issues, the acid what you burp out in your mouth, it erodes the gum line. So there is gingival so it could be it's a very wide topic sensitivity. Either it is you have a dental decay, which has gone inside and touched your dentine, could cause sensitivity, or the way you brush, if you're using a hard brush, horizontal way of brushing, that is called sensitivity. Depending upon what your sensitivity is, the dentist would spot out and you could do a filling, a root canal. It depends upon the variant, the depth of your sensitivity and what is the cause. It could be treated.
Okay. Um, Doc, you talked about dry mouth.
Yes.
I think I have a similar experience because my mouth feels dry all the time. What can I do?
You should firstly see your dentist. Either you have any systemic disease, certain medications which you are seeing can cause dry mouth. You're not sipping enough water to hydrate your mouth. There are chewing gums which has xylitol, which increases the salivary flow in your mouth. So your dentist would recommend it could be either your systemic disease, your health related, or you're not having enough water to dehydrate. High amount of intake of alcohol can dehydrate you, which causes dry mouth.
Okay. Someone has asked, I'm diabetic, hypertensive, and on cancer chemos. Can this affect the oral hygiene? Because I'm taking a lot of drugs.
Yes, as I said in my presentation, diabetes and your gum has a bidirectional relationship with each other. If your gum disease is bad, the diabetes will be not under control. If your gum disease is, if your gum health is very good, the diabetes will improve. Plus, as you said, you have cancer. Cancer, you must have undergone chemotherapy or radiation therapy. They produce the salivary flow in your mouth. And you would notice the ones who have undergone these radiations or chemotherapy, they develop multiple cavities inside the mouth because absolutely the salivary flow is nil. It's very little. The bacteria multiply and grow, and then the tooth breaks very easily. And I spoke about blood pressure as well. If you have uncontrolled, the blood pressure would not be under control if you have any dental abscess. So one, you should be very thorough on your dental examinations. Irrespective if you don't have any pain, please go and visit your dentist every 6 months. It's very mandatory.
Okay, so Doc, I'm seeing we're now stealing some minutes of your time. So please allow us like about 5 more minutes.
Yeah, sure.
And then we can close the session. Does dieting have any relationship to oral hygiene, and does it affect the oral
It depends like what kind of diet you are having. I would say if you start for long, you're not eating, you'll have a lot of acids produced in your stomach. And these acids you'll burp out in your mouth. And they are very acidic. They are so acidic that it can dissolve your enamel and you'll get tooth sensitivity. So depending what kind of diet, if you're engaging in regular eating healthy food, like diet varies, few people now there's intermittent fasting, people don't eat for long hours. So it depends. If you are creating acids in your stomach, it is dangerous for your oral health. As long as if you're healthy eating every 2 hours a healthy food, and diet varies, you're not having too much carbs, fats, you're eating too much fiber, as long as you are not acidic, not creating acids in your stomach, then you're okay. It doesn't work. Yeah.
Very interesting. Okay, so one final question. I have shark teeth.
Sharp teeth.
Shark. Yeah, I guess maybe
very sharp. Yeah, conical.
Yeah, conical. Yeah. They're long and disorganized. I am ashamed to smile. Do you guys do any free camps at the Aga Hospital, Mombasa?
Free camps?
Yeah, like Operation Smile.
We do smile designing. There are a lot of, depending upon, one would say, what could be, it could be malpositioned teeth, or it is not, you just need few fillings, or you need a trimming of the tooth in moderation amount. So we do smile designing, yes.
Okay. So I guess to the person who's asked that question, I hope it's been well answered. So Doc, tell us more. If I want to get in touch with you,
yes.
What do I do? Where do I need to come?
We have our numbers. I will tell you to post. You can book an appointment through us, and you're most welcome. I think we'll share the numbers with you at the end of the presentation. You can call the receptionist and book straight away for us.
Okay. Do you mind also just mentioning where
we have 3 facilities available in Mombasa, and one is our Kizingo branch. So those who are living nearby in town, they can look there. Second is at Nyali branch. It is based at Nyali Center, where Naivas Nyali is. We are based right next to DTB Bank. And the third one is at Kilifi.
All right. So what time can I pass by, and if I want to see you, Dr. Payal?
I would say better to call and book the appointments because of COVID. We generally prefer. Like we do take walk-ins depending upon if we are not that busy. But I would prefer, because of the bad times, better to book an appointment so that we just book the slot for you.
All right.
And,
Okay. So, Doc, it's 10:04. What are your closing remarks?
whatever.
What are your closing remarks?
So I would just say good oral health. It plays very, very important role not only on your oral cavity, but on the long run, your heart, lungs, your blood pressure, sugar, diabetes. So they all are interlinked. Please do not ignore that the oral health is not important. I would suggest to the major hospitals also that when you're doing a complete package health examination for a patient, please include dental examination as well, because most of the physicians, if you have uncontrolled diabetes or blood pressure, a person would be just giving medications without knowing a person has a dental thing. So I would say just don't treat only the symptom, please treat the cause as well. It could be a dental cause which people are not aware of it. So I would suggest, if a person is on, like an elderly person who would like to have a complete body checkup, please don't ignore dental as well. As long as in our facility also, I would talk about this to our management that if please include a dental package with your whole body examination. It is very, very important because now researchers are finding out it has a direct link. So if you want to live long, healthy, don't ignore your dental health.
Wow. So, to our audience, I guess you've heard that. From my end, I want to thank you for joining us during this live session. In 2 weeks' time, we'll have another live session. It's Breast Cancer Month. And we'll have with us Dr. Amina, who's our resident oncologist, and she'll be able to talk more about breast cancer. Thank you, Dr. Payal.
Thank you for your time.
And stay blessed.
Thank you.
All right. Thank you.
Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji, and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception at least 1.5 meters apart, so that to minimize any potential infections. We are also screening our patients when they come in. However, I'd like to say that the services remain unhindered and that we are running as usual. You are always welcome to visit us in any of our 8 outreaches within the coastal region.
At this point, let me also remind you all, we have put in place teleconsultation services to ensure that our patients are able to access our services safely from the comfort of their homes.